Surprising factors that affect your surgery result. Let's talk about it. So I have in previous videos emphasized how important it is to get a board certified plastic surgeon or that equivalent in other countries outside of the United States. And that is still true. But what if I told you that a lot of your result is out of the hands of the plastic surgeon? And that really, when I say get a board certified plastic surgeon, I emphasize that as a safety measure, but really the result is largely in your hand. So here I highlight some surprising factors that you may not have thought of that ultimately affect and largely determine your plastic surgery result. Y'all know I'm not good at numbers, but here's number one. AI has a lot of y'all believing that anything is possible in plastic surgery. And let me tell you, it is not. There are truly limits to what we as human plastic surgeons can do. Now, if you find an AI one, please, by all means, go to that machine. But as human plastic surgeons, there are limits to what we can actually do and how much we can actually change things. And one of the biggest determinants is how your skin is going to respond to those changes that we make. This is especially true when we're thinking of skin tightening procedures, like a facelift, and even like liposuction, for instance, and tummy tuck. And it's also true when we are thinking about changing a lot of the underlying structures and then seeing how the skin will redrape over those structures, as in rhinoplasty or a nose job. So let's talk about lipo for a second. So lipo, the idea is that you're sucking fat out of a container. But ultimately your skin will determine if that result is a good result because you had good snapback after the liposuction, or if you'll look like a deflated bag after the liposuction. The more elastin and collagen that your skin has, the better snapback and the better prediction of a good result. How can you tell if you have good skin and will have a good snapback? Just actually pinch yourself and look at how long it takes for that skin to retract. If it's instantaneous, then most likely after liposuction, you'll have a good result. And the same is true for facelift too. You'll have a good result because the skin has enough contractility that it will actually kind of retract and adhere to the structures underneath. If it takes a little bit longer, then most likely you need some kind of additional measures for skin tightening and not just kind of removal of the underlying fat. Also, if you have stretch marks, then what that means is that your skin has stretched beyond the capacity that it had to stretch at that given moment. And that usually happens because changes are happening so fast. If you're gaining a belly because you're having a baby, your skin is stretching and your baby is growing more rapidly than your skin can adapt, right? And so it's stretching beyond capacity that it has at that moment to stretch, and so you get stretch marks. Now, what can you do to avoid stretch marks? That's a different conversation, but cocoa butter is your friend, or any good moisturizer is your friend. Also, love Aquaphor, so that's also your friend. But the point is of this conversation that once you have those stretch marks, that ability to snap back is pretty much gone, unfortunately. Really what needs to happen is that you need to also have some skin tightening in addition to just having lipo. For those women who have had a baby and have the loose skin and they have the stretch marks, no matter how much you work out, you may notice that that will never kind of get back to what you want it to be. And so this is why it becomes an important area of discussion. Now, when it comes to rhinoplasty, yes, it has to do with the contractility of the skin, but more importantly, it has to do with how thick the skin is. Because when we're doing a nose job, we are making drastic changes to the cartilaginous structures and to the bones as well. But ultimately, your skin has to drape over that. And so if your skin is a very thick drape, and this is an exaggeration of how thick a drape it can be, we can make all the intricate changes in the world, but because your skin is so thick, it will not reflect those changes as well as we would want to. This really becomes a discussion with your plastic surgeon about how thick your skin is, how realistic your expectations are of getting that nice pointy nose when you have thick, oily skin. We can thin skin, and we do oftentimes thin skin when it's so thick and may camouflage what really could have been a really drastic result or drastic change. But also note that thinning skin means losing some blood supply. And so there's only so much that we can do in terms of thinning skin before we actually get frank necrosis or we're killing the tip of your nose. So that is a very important thing to consider. Number 2, I'm doing well so far, right? Your age. How old you are. Now, I say age is just a number, right? Just in the words of Aaliyah and R. Kelly, who wrote the song. Let's keep that in mind. But seriously now, age can be a number, and you're never too old to consider a change or plastic surgery. With that being said, the older you get, the more realistic expectations you have to have about what your results will be. Younger patients, especially when it comes to skin tightening stuff, have better results because they have more collagen and elastin in their skin. As we get older, we lose that, and so older patients can have some suboptimal results if this is not taken into account. And for older patients, what it can mean is that when underlying fat is removed or tissues are lifted, that you may see some poor skin retraction. And these procedures may actually highlight even more so how lax the skin is by creating a more bumpy look. The key is to find the right surgeon who does not have a one-size-fits-all approach to everything that they do. Because what happens is, if they do and they don't take into account your aging skin, then you could have a suboptimal result. And that's why training is important, and making sure you actually have a board-certified plastic surgeon who has been trained in plastic surgery, because we learn lots of tricks and tips over the years, more so than if you were to do it as a weekend course in Maui. Number 3, ethnicity. Your ethnicity actually has a huge impact on your results. Increased melanin is beautiful. Love it. Can't get enough of it. But for us folks with darker skin, we can have more aggressive healing, and that can lead to things like keloids and hypertrophic scarring. We also have a greater risk of having either hyperpigmented scars or darker scars when we heal, so that's something important to keep in mind as well. Number 4, the occasional glass of wine at dinner. Now, while most of us are not self-professed alcoholics, a lot of my patients do report to drinking socially, and maybe you do too. And that's totally fine, no judgment here. But it is important to note that drinking alcohol around the time of your operation can actually be very harmful, even if it's just the occasional glass of wine at dinner. Alcohol dehydrates you and also increases inflammation. Those two things can make wound healing worse and not better. Also, alcohol has an impact on blood vessels. It dilates them. And so what that means is that it can increase swelling and bruising around the time of surgery, which also makes recovery a lot harder to do. And the third thing that's really important to keep in mind with alcohol consumption is that alcohol is metabolized largely by the liver. And so are many of the drugs that we give to help with recovery after surgery. You can increase your risk of liver injury, liver harm, and liver damage that may or may not be reversible by combining the two. And also, if you have increased alcohol consumption, you can also have increased tolerance to pain medication, meaning that you would require a higher dosage of pain medication than would a person who doesn't drink alcohol socially to achieve the same effects. This can be dangerous as well and can lead to an overdose. It's very important to limit, if not just completely abstain from alcohol consumption around the time of surgery, both a few weeks before and several weeks after. Lastly, a surprising factor that you may not have considered is your body composition. There is such a thing as being big boned, right? And this becomes especially important with body contouring procedures. I find a lot of women want to look tiny and feminine, but a lot of us have kind of wider builds that make that not necessarily possible, even with the same procedures that we're doing on other people. The other thing is that you have to understand where your fat lies. Especially when we're doing body contouring procedures, the result is going to be largely determined by where your fat is. So if you look down at your belly and you have a barrel belly, meaning and it feels kind of tight and compact, that means a lot of your fat actually lives around your organs, your internal organs. So around your stomach, around your liver, around your intestines. That fat we cannot actually suck out because that's actually very dangerous. We can basically create holes in your stomach, in your intestine, and that's very dangerous and will kill you for sure. Or I should say a very high likelihood of death, okay? So we cannot access that fat. Really, that comes down to just weight loss. So again, that's a point of discussion with your plastic surgeon, because your plastic surgeon, like I, may recommend that you lose more weight before you actually get, say, a tummy tuck or lipo or things of that nature, because even if you get the tummy tuck, you're still gonna have a barrel belly, okay? So those are the 5 ways and the 5 factors that you may not have thought of that actually affect your result incredibly. What do you think? Any of these factors come up for you? Leave your comments and your questions below. Like and subscribe. And as always, love you lots and bye for now.